Hi, everyone, and welcome to the National Cancer Institute Facebook Live chat, Coping with Cancer and Other Serious Illnesses During COVID-19. My name is Wiener, and I'm pleased to be joined by two experts in the field, Dr. Audrey Thurm and Dr. Krystal Lewis. I head the Psychosocial Support and Research Program here in the Pediatric Oncology Branch of the National Cancer Institute. Audrey and Krystal, would you like to introduce yourselves and tell the audience a little bit about your own backgrounds?
Thanks, Lori. Hi, I'm Audrey Thurm. I'm a child clinical psychologist at the National Institute of Mental Health, and I work in a service called the Neurodevelopmental and Behavioral Phenotyping Service, where we focus on children who have medical needs as well as genetic disorders, and especially young children. Krystal?
Hi, my name is Krystal Lewis, and I'm a clinical psychologist here at the National Institute of Mental Health, where I primarily work with a team of researchers investigating the relationships between psychological symptoms and brain function, with a specific focus on pediatric anxiety. I provide cognitive behavioral therapy for children who participate in our studies.
Well, thank you, Audrey, and thank you, Krystal. I'm so glad to have you here with me today. So we've all heard about how COVID-19 has spread across the world. Life has changed for all of us. Schools have closed, all gatherings of more than 10 people canceled, and many people are only seeing their healthcare providers through remote means. The health anxiety our world is facing right now is not new to people living with cancer and their families. This is something that you face every day. I've heard so many families comment on how the rest of the world is now experiencing firsthand many of the fears and concerns of every childhood cancer parent. Today's chat, we're going to be trying to answer questions from families with children experiencing serious illness. And we won't be going into any details about COVID-19. Instead, this chat will really provide resources for dealing with the additional stress of the pandemic while coping with cancer or other serious health conditions. To learn more about COVID-19, please visit the CDC website at cdc.gov. But I'm going to start by providing a few tips to consider based on many of the questions that have already come forward for this chat. So thank you for those. And all the tips start with the letter C. Calm. We need to prioritize our own self-care in order to manage our own anxiety. Children take their cue from the adults in their life. If we're constantly checking the news or washing the floors, or they hear us talking about the train of terribles that are going to come from this, our children are going to sense our anxiety and they may react by becoming more anxious. So when you feel your own emotions being hijacked by fear, find a way to calm down, whatever works for you. Try to find a time each day for at least one healthy stress-reducing activity. Think about what's helped you when your child was first diagnosed with cancer, or during scan visits or other highly stressful times. The next is continuity. Consistency and structure are especially calming during times of uncertainty and high stress. Children, especially those who tend to be anxious, benefit from knowing what is going to happen and when. Control. Provide choices when possible. Again, parents of children with cancer are generally masters at this skill, especially when it comes to taking medication. This is especially important now when we don't know when life will return to our previous normal. We all do better when we feel like we have some control. Connection. Social support is a protection for good mental health. So find ways as a family to be creative about new ways to socially interact with family and friends, and how to communicate with your medical providers. The key is to reduce isolation. So for example, families may like to be able to have breakfast with grandparents. Teens may join friends for lunch using FaceTime or another social media platform. During this time, we just need to be more intentional about our communication and our connections. And creativity. Think together about expressive outlets that you can provide at home. Some families have created comforting messages using colorful chalk, in front of their homes. Others who play a musical instrument have opened their windows so others could hear, whether they play well or not. I've heard about families planting a garden together and looking forward to seeing new vegetables grow. This would also provide a sense of control so that they may not need to go to the grocery store so often. There are free art classes online. The American children's book illustrator and cartoonist and artist Carson Ellis started a quarantine art club on Instagram with daily assignments for people stuck at home. And last, compassionate. This is real. It is okay to feel anxious, scared, or angry right now. Accepting and validating these feelings is so important because we're all having them. We're all building our tolerance for uncomfortable feelings and learning how to coexist with them. And parents of children with cancer and other serious illnesses know all too well how exhausting anxiety can be. So while we all modify our definition of what a good day is, be kind to yourself when things don't go exactly as you hoped. Eliminate that word should from your vocabulary. It just reinforces the negative, what we're not doing, and it's not at all motivating. Celebrate what you are doing, big or small, like joining us here today. So with that, let's get to some of your other questions on coping during the COVID-19 pandemic. As you have questions, please ask them in the comment section, and we will answer as many as we're able to. Questions we don't get to will be answered after the event in the comments. So let's get started. First question that came in is, what are some ways we could protect or improve our mental health during the pandemic? Krystal, would you like to take this question?
Sure. So there are several things that we can do to cope with the stress of what's going on right now. First, I would say it's most important to know the facts and seek information from trusted sources regarding updates on COVID-19. This can help you feel informed and reduce general feelings of uncertainty. But in doing so, it'll be important to limit your news consumption while staying informed. So check the news only 1 to 2 times daily so that you don't feel overwhelmed with information, which we know can then increase fear and anxiety. This includes taking breaks from social media and TV, where conversations around COVID-19 are plentiful right now. Another way to protect our mental health is to practice good self-care, taking mini breaks over the course of a day. Find time to laugh, do things you enjoy, spend time with your kids doing arts, crafts, cooking, anything that you find enjoyable, and do it often. An important way to maintain mental wellness during these stressful times is also to maintain a schedule. However, don't get carried away with extensive scheduling and unrealistic demands for yourself and your family. And taking care of your physical health is also quite important for mental health. This might include engaging in exercise, getting plenty of rest, eating regular meals with healthy foods, and minimizing alcohol consumption. When we feel good physically, it helps us to be more focused and productive over a course of a day. Parents should be mindful of taking time to re-energize and keep yourselves healthy so that you can continue to provide good care for your children who need the extra support and attention. Be kind to yourself and know that these are stressful times, as Lori just mentioned. Recognize that you might need to take more breaks and tend to your mental, physical, and emotional well-being more than you had to prior to this public health situation going on right now.
However, some people, especially those who may have already been suffering from mental health as well as serious health problems, may find themselves in a crisis situation with respect to mental health during this time. If you or someone you know does have a crisis, there are resources. There's a 24-hour crisis hotline, which is the National Suicide Prevention Hotline that has a 1-800 number, 1-800-273-8255. There is a website that we're putting on the chat right now that goes along with it, where you live chat, and there are many resources available on that website. In addition, many local communities have community mental health centers and crisis centers. And if the person in crisis is already in treatment, they should be in touch with their provider as well as calling 911 if there's ever a true emergency. And many therapists are using telehealth right now. So there are ways of seeking treatment without compromising social distancing health safety practices.
Thank you both. What important information. So the next question is, how can parents cope with guilt of potentially making the wrong decision to hold off on treatment or surgery? I'll take that one. Guilt is not new to many parents of children with cancer who weren't able to prevent their child's cancer diagnosis or feel powerless when they can't control their child's altered life, pain, or suffering. Yet in the midst of this pandemic, the decision to having treatment or surgery postponed or delayed may well be out of the parent's control. as this is often being guided by medical and public health experts who recommend that outpatient visits should be limited and other means of communication, such as phone or digital or video communication, prioritized. So shifting energy and focus to what parents can control could be helpful. So things that come to mind is consistent communication with your child's healthcare provider, especially regarding the changes you witness or any new healthcare concerns. Communication about what's happening with the clinical trial your child may be on. Developing a plan or timeline for when treatment will resume or surgery will occur. Review a what if, then what scenario with your child's providers. This is important because this could be able to help you have a concrete plan if something on that what if list does occur. And perhaps more than anything, when feelings of guilt start bubbling up, as we said before, allow yourself a large bundle of self-compassion. Acknowledge all that you are doing to keep your child and other members of your family and the community safe. And remember, and I could say from here, that there's a whole team of people out there that really want to keep your child healthy and safe as well. I hope that answered those questions about feelings of guilt. The next question is, what can we do when we're feeling overwhelmed with anxiety? Well, Krystal, you are the anxiety expert, so how about you take this one?
Sure. So I think it's very normal right now for a lot of people to be experiencing anxiety, and there are several things that we can do to help. So I'll start with the importance of taking a mindful minute. What that means is stop what you're doing and take some slow, deep breaths. Notice the air in and out of your body. Focus on body sensations and your experience of breathing. Find activities that engage your senses. These can deactivate the sympathetic nervous system and help relax your body. So you might take a moment to walk around your yard or walk around in your neighborhood and focus on sights and sounds around you. It's also important to help kids engage as well in mindful behaviors, help them to do some breathing when you're doing particular activities like cooking or baking. Have the kids focus on the feel of the dough, the smell. Ask them whether it's hot or cold. So essentially, we know that mindfulness helps us to focus our attention. It calms the body and mind and promotes happiness while reducing stress. We know with anxiety that anxiety is linked to a sense of uncertainty and a lack of control. And so creating a schedule and having at least a daily routine, as mentioned before, helps to reduce overall anxiety and can increase our sense of control to some degree. A big thing here with anxiety is focusing on our thinking. It's important to identify any unhelpful or scary thoughts and attempt to reframe them to increase your belief that you're able to handle what might come. And so it's helpful to have little mantras or just helpful statements like, this too shall pass. Tomorrow is another day. Everyone is doing okay. Any thoughts that really help shift the mindset when you're feeling anxious. And so while you're practicing catching your own unhelpful worry thoughts, it's important that you try to help your child do the same thing. Point out when it seems that they're verbalizing a thought that isn't helpful and work with them to generate more helpful thoughts. Provide some reassurance, yet teach them to come up with their own coping strategies for unsettling thoughts. So teach them to answer their own questions they might have when they're worried about whether school is going to be closed forever, if you're going to get sick. The best thing to do is answer these questions in a developmentally appropriate way, providing short and truthful replies, and using resources that are out there. We will provide a list of resources for you guys to refer to as well. Another thing that we can do is stay connected. And so although we're maintaining physical distance to help manage our anxiety, it can be helpful to talk to friends or family using social media, FaceTime, have virtual dinners, play virtual games with individuals. This can create a sense of community and connection and lessen overall feelings of anxiety, loneliness, and sadness. The same way that's important for you to connect to friends and family, it's equally important to help kids stay connected to their peers as well. So set up some virtual play dates for younger kids. Encourage your preteens or teens to connect with family and friends via social media, have movie nights, do different things. Having these social experiences with peers can help to normalize their experience and help them to manage the anxiety they might be experiencing. And lastly, just try to be active and exercise. We know that exercise can help, ensuring that you're moving throughout the day. Schedule time to either go for a walk, go for a run, do some hiking, get some air outside. Have family dance nights or family exercise time. There are wonderful apps and prepared guided workouts through YouTube or certain apps that you can use. Overall, exercise is beneficial to our physical and mental health and can reduce anxiety.
Those are some wonderful tips. Thank you. I know some of our patients here are writing quarantine letters to other patients that the nurses are delivering. So people are getting creative.
Yeah.
The next question is, how are siblings being supported, informed, and included during this time of prohibition from the hospitals? Audrey, you have a lot of experience in this area. Would you like to answer this one?
Sure. We know that siblings don't always get along perfectly, that's for sure. And siblings, have a difficult time when there is someone in the family with a medical illness, just by definition. So normal sibling issues that are there may be exacerbated during this time. Siblings of children with medical illnesses sometimes feel neglected, especially if they can't participate in the medical visits that they may have been able to before. And that's perfectly normal, even under regular circumstances, for siblings to feel neglected. But during this time of social distancing, this may happen even more frequently because they also don't have their normal outlets, the ability to turn to friends and go out and do other things. So children with significant mental health needs may also be more needy during this time for various reasons, including not having the supports that they normally have. So they certainly may be more taking time from their parents' attention. So all this is just something to keep in mind as you generally give your kids just more benefit of the doubt during this time in general, and showing them more compassion for, having a shorter fuse or wanting to be alone more. We know that we just need to take this extra special care with the siblings.
Yeah, those are some great suggestions. It's interesting that children with cancer are telling their siblings, now you know what it's like to live in isolation. Supersibs.org is a wonderful organization that has terrific resources for siblings of children with cancer. So people, if you're not familiar with that, definitely check that out. The next question, how can young adults connect with others their same age experiencing cancer or other serious illnesses during this time when we can't get together in person? Adolescent and young adults, we affectionately call them AYAs. Well, they are particularly affected by the isolation that can come with COVID-19. So I'm happy to be able to address this. It's critical in this time to not neglect their mental health and to find good, reliable resources to stay connected. To combat loneliness, AYAs, they need to be able to make full use of virtual connectivity tools available to them. There are organizations like Stupid Cancer that have weekly meetups and webinars, but there's other organizations such as Cancer Care, Leukemia and Lymphoma Society, the Cancer Support Community that have programs and events to keep young adults connected. I just heard about a new organization called COVIDAYAcancer.org that has been designed to give AYAs with cancer and survivors access to information and services such as financial resources, virtual events, employment and psychosocial support, along with online supportive programs. Now I'm going to turn to some live questions that are coming in. The first is, do you have any advice for parents who stay at home due to COVID and have a son who's in active treatment? Audrey or Krystal, would you like to be able to address that? I'm happy to help.
Sure. So in terms of advice for parents who stay at home, I think just referring back to the importance of self-care for parents, and I don't know if I'm answering this correctly, but self-care for parents and taking time to kind of re-energize and reduce feelings of anxiety and feeling overwhelmed. Trying to create some moments of joy in the home is important. And so I think the question here is that they have a son who's in active treatment, which is an added stressor. And so the fear and anxiety of having to go for treatments, I think can just add to the general anxiety. And so I refer back to the earlier points that I mentioned about just practicing good self-care. Audrey?
Yeah.
Yeah, and again, for parents who may not be able to go to see their child or interact using those other means, social media, FaceTime, connecting even at their appointments through these other means, if it can't be live.
I just add to that is that if this child or you have children in active treatment and there are siblings, this is where the advice that you just heard from Audrey before is really important. This is a very hard time. You're trying to work and you have a child who's in treatment and you may have other children that are at home right now. The schedule will be helpful, but you really also want to be able to find a way to meet the needs of all the children that are in the family. And again, be kind to yourself. The next question is, what advice do you have for families who have lost a child to cancer or other life-threatening illnesses and are living with grief, which is now compounded by the coronavirus? Well, thank you for that question. I have such compassion for parents who have lost a child because this is, a traumatic. The grief is traumatic, the loss of the child is traumatic, and this just triggers a lot of that grief right now. And to be able to go back to what has helped you get through those times before, and to be able to reach out. I think this is a time that reach out to other parents who have lost a child with cancer, because I can tell you that they are grieving too all over again while they're watching images of people dying, saying goodbye, and the isolation they felt through all of that time. It is truly a trigger. My heart goes out to you, and please do reach out to others. Was there another question that came up?
Well, I'll just add in the meantime that just the media, luckily, is actually using words like grief more openly now during this time, because it does feel in a lot of ways like our entire society is grieving right now. We're grieving the sense of normalcy. We're grieving the ideas of things that we should have been doing, could have been doing, would have been doing. And we're grieving for seeing the numbers of people who've lost their lives to COVID already. And so I will just echo what Lori said, is that it is triggering, even if the loss was not recent, even if the loss was a long time ago. It is triggering just the sense of grief, which may happen at different times, unexpected times. And we just hope that people can seek support as they need to for the feelings that are coming up.
Yeah, I think of it as a tsunami of grief. Okay, I'm trying to think. The next question, I don't want to show my child that I'm extra worried about what's going on right now. How do I explain my stress to my young child? That's such a great question. So I know, Audrey, you work with a lot of very young children. I don't know if you want to be able to start with some ideas.
Sure. I absolutely hear that question a lot right now, is that it is extra stress. And it is definitely one thing to do is when your child asks you a question, to answer that question. If they say, why are you watching the news more? It's okay to say, there's more news right now. There's different news right now. There's news that we need to hear so that we know what's going on. To answer their question exactly as they ask it, maybe not answer other questions, but just that question for sure. The other thing that I think parents find really helpful sometimes is to use books or shows or other outlets to help them explain things. So, if you have books about stressful times, or even, other things that are stressful, like weather events or even loss of life, to be pulling out those books and explaining, what's happening for young kids, books like Berenstain Bears and Arthur and who have other characters that they may be familiar with that experience these things. It can be really helpful to use those as ways to show that other people go through stress and they get through it and they move on. And it's something that can happen and we get through it.
There's actually a new book that just came out today that I got information about today, which I will post after this. I think it's from this, Alexander and the Horrible, Terrible Day, but it's in that same vein. So I will put that out. And I think this is also a teaching moment for your young child, to be, your young children, to say, why you're stressing that. We're stressing, to talk to each other about what stress looks like and then do something. Let's do a stress busting activity together. And so to be able to give it some levity, but it's to be able to sit with that and to be able to say, I'm worried about you staying healthy. I'm worried about your family staying healthy and me staying healthy. And these are all the things we're going to do to stay healthy. But let's practice, again, some stress busting activities here. The next question is coming in. Thank you for this talk. Well, thank you for saying that. We have some stress related to upcoming travel for medical care. What tips do you have to navigate this smoothly to minimize risk of exposure? That's a very complicated and very important question. And I would send this back to your medical provider, because if they feel that it's safe for you to be able to travel. And then there's really good guidance for going through an airport, being on an airplane, not taking any of the drinks at the airport, making sure that you have all the equipment that you need. And once you get to the airport, not going on mass transportation to get to the hospital from there. We'll see if we could be able to put up some information on that. So thank you for that question. I'm getting a note that that's all the time that we have for questions for today. We really want to thank all of you taking the time to watch this latest Facebook Live from the National Cancer Institute. But before I have some closing comments that I'd like to make, Audrey and Krystal, do you have anything you'd like to add?
I can just say that these are tough times for everyone right now. So as you mentioned earlier, Lori, I think it's important to be kind to yourself and know that you're doing the best that you can. Caring for medically compromised family members with the added stress of this quarantine is most definitely going to increase your stress. So I think it's just important to remind yourself of your resilience and what you've gotten through thus far. And then just continue to practice self-compassion, which helps us to get through adversity.
Yeah. Go ahead. Audrey, did you want?
No, I'll just add that it is hard to be a parent any day of the week, and it is just especially hard right now. So parents, just give yourself a pat on the back every day for getting through the day. That's what we say right now.
And for those parents who are grieving the loss of a child, please know that we are grieving with you. All right, just some final comments. It looks like we have just 2 or 3 more minutes left. As you've heard, COVID-19 impacts everyone. You've heard different comments about and tips about just staying informed through reliable sources, to focus on what's in your control, to do whatever it takes to reduce your stress level, but think outside the box and maybe try something new, to communicate openly with your healthcare providers and those close to you. And perhaps, I think about what you want your family story to be when this is over. Can you name anything your family has done that you might not have done or experienced if COVID-19 didn't enter your lives? Perhaps you completed a large puzzle for the first time, or participated in a family Zoom exercise class together. My son and I were on a Zoom class, yoga class together on both sides of the country. Maybe your family has gotten to know each other better, coped with uncertainty better, learned a new recipe, or watched a funny YouTube video and laughed really hard together for the first time. Maybe you connected with people you wouldn't have connected with if it wasn't for this pandemic. And if you haven't done something that you want to favorably remember later, it's not too late to create your story. And finally, find opportunities for gratitude. Gratitude and acts of loving kindness are some of the greatest antidotes to fear. And I would be remiss if I didn't mention how impressed I have been with how resilient families of children with cancer have been. Fear of infection, social isolation, living with uncertainty, financial challenges, death anxiety. This is not new to any of you. So we just want you to know that we acknowledge your strengths, your skills, and the abilities that you have developed from your cancer journey. And we hope that you'll be able to continue to draw from those skills and perhaps some of what we shared with you today to guide you through this health crisis. That's it for today. This video will continue to reside on the National Cancer Institute's Facebook page and YouTube page. Thank you so much for joining us today. Goodbye.
U.S. Department of Health and Human Services, National Institutes of Health, National Cancer Institute, cancer.gov, 1-800-4CANCER. Produced April 2020.